Welcome back, everybody, to another episode of the Nonprofit Show. This is a really special episode. I think about every episode being special, but I think this guest has really impacted my life and my community. And while I've said this to him in passing and witnessed this to he and his family, this is really profound. And so I'm really excited to welcome Jonathan Cotter here, CEO and the founder of Children's Respite Homes of America. That intro is like kind of a downer. I didn't mean it to be. Jonathan?
Well, it's a special day. I really appreciate having the opportunity to talk to you, Julia, and the Nonprofit Show, especially on today. This is National Giving Day and Giving Tuesday. What a fantastic day to do this.
Yeah, it's really crazy. I don't know about you. So we are both in Mountain Standard Time in the Western United States. It's still, mid-morning here. I think I'm at about 45 emails and texts for Giving Tuesday already that have come into my box.
Yeah,
I don't know where you stand. It's a lot. It's a big day. To your point, Jonathan, it's a really big day. Every day is a big day for us as well on the Nonprofit Show because we have this amazing group of people that support us. Our presenting sponsors include Bloomerang, American Nonprofit Academy, Staffing Boutique, Nonprofit Thought Leader, Fundraisers Friday, Your Part-Time Controller, Third Sector Company, and Clear Impact. These are the folks that align with us. And we're coming up, I was telling Jonathan, on our nearly 1200th episode. So these are the folks, pretty much every single one of them have been with us from the beginning. Again, if we haven't met, I'm Julia C. Patrick, CEO of the American Nonprofit Academy. We have this amazing group of co-hosts that come to us from all over the country, incredibly diverse pieces of work and action in regions that they serve, and they are just a delight. And I hope that you've been able to get to know them as well as I have. Okay, Jonathan Cotter, CEO and founder of Children's Respite Homes of America. Jonathan, you're from my community, and I was thinking, and I said this to you briefly in the green room, for good or for bad, you have created a standard in our community that we all just know or think that there are facilities, and we'll talk about this, like Ryan's house, all across our country, that we have these respite homes, and no, we don't. Right?
Right, exactly.
It's so fascinating. I'm just so proud of you for moving beyond our community and working on a national, dare I say, global environment. And so we're going to really get into this even more. So what an honor it is to have you here with us. Talk about Ryan and Ryan House.
That was a great place to start. And I love starting at that very beginning because I always like to introduce myself as a proud dad. That's always where I start. And I used to say that and when I started this new pathway, I used to blur out my background. And I thought, no, I'm not going to do that because clearly I'm in Ryan's bedroom. And this is really a fun space for me because this is where Ryan lived. This is not where Ryan died. And some of those Marvel posters and X-Men posters and Doctor Who posters, some of those are autographed. My son had an awesome life. It just was way, way, way too short.
Right.
And so Ryan really is my inspiration. He clearly is my North Star. And really just a quick summary of our story is that we are an Arizona family. I grew up in Arizona since kindergarten. My wife, who I've been married to for 32 years, is a true Arizona native, born and raised Tucson, Arizona. So this is home for us for sure. This is where all of our immediate family is. But about 20 years ago or so, my wife and I went off to see the world. And my career at the time was a marketing person. I worked for big global companies, brands that you know and love. I worked for Dial Soap here in Phoenix. Then we went to Green Bay, Wisconsin, and I worked for Breyers Ice Cream. Then we moved to Minneapolis for a few years, and I worked for Pillsbury. And it was the doughboy that sent us to London, England for a 3-year job assignment. And that's really where this story begins, because it was in England that our second son, Ryan, was born. And our older son was 1.5 years at the time. He's now 26 years old. But back then he was 1.5 years when we moved to London. And this was supposed to be the perfect little family, the perfect life story. We moved to England for 3 years. We come back to Minneapolis. We raise our family. Wouldn't life be great? Well, it didn't turn out like that, because in England during that time, professionally, the Pillsbury organization was acquired by Betty Crocker or by General Mills. So I say that the Doughboy sent us to London, but Betty Crocker brought us back. And from a life perspective, Ryan was born, and Ryan was a perfect birth. He was our second child, so we were really knew how to be parents and change diapers and kind of go through the early stages. But at 8 months old, 9 months old, we really realized that Ryan was not developing as typical children. He really couldn't hold his head up. He wasn't sitting unassisted. And so that put us on a path to specialists. And quick story is that Ryan ultimately was diagnosed with a life-limiting condition called spinal muscular atrophy, or SMA. And this was 20 years ago. So back then, there were no treatments and no cures for SMA. And we were basically told, take him home, love him, but don't expect him to celebrate his second birthday. So our world was shattered. And we're 11 hours away from the closest family member, all back in Arizona. And so we really were trying to struggle with how are we going to go through this life with a newly diagnosed, life-limiting condition child. And we still lived in England for another 2 years before we moved back. Well, what ended up happening is that we were trying to now kind of live life. And we were going to lots of doctor's appointments, lots of physical therapy appointments for Ryan. And it was his physical therapist that recommended that we go visit a place called Helen House. And Helen House happened to be 45 minutes up the road in Oxford, England, where we were living in London. And it was described as a children's hospice house. So for us as Americans, we absolutely rejected that. When we were told to go visit Helen House, we said, nope, that's death, that's dying. We need to save this child, even though there is no cure and is no way to do this. That's where our focus. We need to have hope. And so the professionals around us kept telling us, you don't understand. This is a place for living, not a place for dying. It really is going to provide comfort and care and support along this very difficult journey. And they're going to provide what's called overnight respite, which is really a chance to sleep and to somebody to care for your child so that mom and dad can basically get an opportunity to get a quality sleep, recharge, and then get back onto this very difficult path. So we eventually said, all right, stop bugging us. We'll go check out this place. And when we walked in the door, we're like, wow, this is not what we expected at all. It truly was a large family home, 8 children bedrooms, 3 family suites. It was very custom built for kids. So it really was, it had a sensory room, a hydrotherapy pool, art rooms, accessible playgrounds. It just truly was the warm blanket of care that our family needed at that time. Lo and behold, there were 54 of these kinds of homes scattered around England. And when we came back to Arizona 20 years ago, on our last visit to Helen House, we asked them, okay, how do we continue this care in Arizona? Because we're now used to this. This has been very important to us. Ryan has stayed multiple times for respite stays so that Holly and I could get a break. We could spend quality time with our older son. And the team at Helen House looked at us and kind of shook their head and said, sadly, there are none of these in the United States. And so we said, well, that stinks. There's nothing we can do about that. But we need to get back to Arizona. We are approaching Ryan's second birthday at this point, a date that we never thought we would reach. And we needed to surround Ryan with love and family and get back to Arizona. So we did come back to Arizona, got Ryan kind of, settled with doctors. We did celebrate his second birthday, which was fantastic. I got a job as a director of marketing at a dental pharmaceutical company, and life kind of continued. Well, within a year of being back, Holly started passionately talking about our experiences at Helen House, and a community started to rally around us. And this was something that my wife and I never intended to do. We often say that the stars were aligned because people started kind of coming around us, hearing our stories of Helen House, understanding how difficult and stressed children with life-limiting conditions and their families are on these journeys. And they kept saying, wow, I can't believe that Phoenix doesn't have something like this. We need to make this happen. And so one day, Holly and I kind of looked at each other and said, I think everybody's telling us we need to do this. I guess we're doing this. And so that's when we incorporated Ryan House. This was back in 2004. We incorporated Ryan House. All these amazing community leaders that had started to kind of become involved with us became our first board members. I became the first board chair. I'm the one that filled out all the 501c3 paperwork to become a nonprofit. We just started rallying a community, and it just an amazing community in Phoenix started to come together. It took us 6 years of working hard, capital campaigns, raising money, getting the Phoenix marketplace ready to open a home like this. And in 2010, we officially opened Ryan House. And when Ryan House opened, it became the second one of these kinds of homes in the United States. Now, our country is 5 times larger than the United Kingdom. So if you take the 54 houses in England and just translate that to our population size, we should have 266 of these homes scattered around the country. And Ryan House was only the second one to be open. And then that became life. And so at this point, we never thought that Ryan was going to hit his second birthday, but we did celebrate that. We never thought Ryan would be alive to help open Ryan House, but he was part of the rope untying to open Ryan House. And then he stayed at Ryan House for multiple respite stays to really support our family along these journeys, along with many other families. Because this isn't just a place for children with spinal muscular atrophy. This is any child with very complex, very medically fragile children. These are pediatric cancers or neuromuscular diseases. Many of these are rare diseases that families can't even pronounce what these children have. The common denominator is that children are not expected to live into adulthood. So not only are they 24/7 care around the clock overnight, lots of emergency room visits, lots of care needs, but the stress and the strain on these families is just immense. These families are zombies with just lack of sleep. It's just incredible.
Yeah. It's interesting to see that from my perspective, how not only were you dealing, and I don't want to use the word burden because I think it's a negative thing, but you were in this life, your families, your parents, of whom I know, and yet you were able to, or you found the gumption to step outside of yourselves and develop this program that had never been done here. People didn't understand it. You had to educate a whole city and state, and dare I say region, into understanding, what this looked like. So I kind of want to go back a little bit and ask you, how were you able to communicate what was needed when it's not a standard one size fits all? I mean, Ryan's needs in life so different from probably any other child that would in their family that would come through. How did you kind of, if you will, boil this down so that you could get that message out and really communicate what you were doing and what was needed?
Yeah, I mean, that's a great question. I think that oftentimes when people ask me, how did you do it? I often say, you know what we did? We hugged. That the reality is that these are very emotional stories. And then when we're out in the community, and we were very fortunate to have some amazing community leaders get involved in this project. Holly and I had no idea how to start a nonprofit. I was a business person, so I understood business and marketing and communication and awareness driving activities, but I didn't know how to do nonprofit status or any of the board governance or board development or any of the things that were related to nonprofit work. And so I was learning that along this journey as well. Holly, my wife, was an elementary school teacher by training. So this really showed that, what it really took was heart and passion and drive and just keep moving forward. And so I often think that you can't be frustrated. You just got to keep believing in your vision and your mission and just keep going and talking passionately, and good things will happen. So there's going to be good days and frustrating days. And just know that if you just believe, just keep going, and the right people will get involved at the right time to really make magic happen. And that's really what happened with Ryan House.
Yeah. I think one of the things is the blessing of your marketing background, because from the get-go, it seemed like you were a great communicator, right?
Yeah.
And I feel it's very important for me to witness that your family and you never exploited Ryan.
Right.
You know, that was, I think really magical. You could have, and you chose not to. He was included, certainly, but he was never, I feel,
Well,
exploited.
yeah.
And I
And
think
in
that's
fact,
pretty
on that
magical.
point, I would say that Holly in particular, my wife, was very clear that this is not Ryan's house with an apostrophe S. This is
Right.
Ryan's house. Ryan is a
Right.
representative child of the kind of kids that are staying there. But this is much more about the families in our community. The reality is that there's almost 1 million kids going through these very difficult, medically fragile journeys in the United States. Every day, every 20 minutes, a child with medical complexities is going to die. So the reality is you may not see these families out in the community because these are tough lives and they often are kind of isolated. They're really stressed. They're not out at restaurants. They're not out in movie theaters because there's suction machines, there's wheelchairs, there's so much equipment. They need to be close to the equipment and they're just so tired that they're just not out in the public as much, but they're out there and they
Right.
need our support. And that's really what I think drives me. What also happened during these years of Ryan House development is that one of the things that I was very clear to do was to look out into the country and say, come on, we can't be the only ones trying to do this. There has to be other people wanting to do this. And what I discovered by really now thoughtfully searching for others in the United States, that we're not alone, and as I mentioned, Ryan House was the second one of these homes in the United States. The first home is called George Mark Children's House in Oakland, California, in a suburb of Oakland, California. And they opened the year that Ryan House incorporated, very much inspired through their history, very much inspired by the UK model as well. And then for years, it was just the two of those houses that were open and alive. But what we discovered is that other communities and other passionate leaders were trying to do this also. But it was really difficult because what you have is the barriers in the United States to opening these kinds of homes. It's not just about intent and wish to do this. The problems and the barriers in this country are regulations and policies, because what we're trying to do is the United States is really geared for adult healthcare. And what we're trying to do is put a children's care model into an adult world. And so it's a square peg in a round hole. And so what we really need to do is kind of reframe and rethink how we support children's healthcare in the United States. And so Ryan House here in Phoenix is very philanthropy dependent. Ryan House has an amazing board, has an amazing team, and very successfully raises $3.5 million a year, every single year, to support the work that happens at Ryan House, the overnight respite, what's called palliative care support, emotional, psychosocial supports, and also end of life care. That's all covered under philanthropy dollars, because and that's really hard to do. So that's part of the magic of why Phoenix is very successful at this. It's a major market. It can do this, and it's got an amazing team with Tracy Leonard Warner as the executive director there, the amazing board, and they raise $3.5 million a year. But other communities really struggle to be able to kind of create that machine to do that. So what happened across the country is that people started to kind of come together informally and say, wow, we really want this. And wouldn't it be great if someday we had national leadership for this? Well, the problem was nobody was willing to step up and actually lead this national effort. And that includes myself. I was not willing to do that during those years as well, because I was still very involved in Ryan House on the board. I was still dad of Ryan, and I still had a professional. Now at this point, I'm a vice president of marketing at other companies here in town. And so we were living the life.
Yeah.
Then Ryan died.
Yeah.
And when Ryan died, that changed everything for me. That became a significant tipping point and something that really hit me hard. And so Ryan died 6 years ago this week, actually. So this week is a kind of an intense, hard week for me personally, because it was December 5th and then December 7th. December 5th is when the horrific couple of days happened. And then December 7th is when he actually died. And he did die at Ryan House. He did take his last breath at Ryan House. Coming out of that experience with Ryan's death, Holly and I talked, and I said, you know what, I'm so frustrated at the U.S. healthcare system and how we support children along these medically fragile journeys that I think I can do more at this point, and I need to get involved, but I don't want to do it again from a grassroots level. We need to get involved at the federal level, at the national level, and really start to go big and really help make things happen. So what I did and decided to do was to actually go back to school and go become an expert, quote unquote. So I decided to give up my marketing career, applied, went back to school, got a master's in public health at Johns Hopkins. I did the entire MPH program in 11 months on this computer, which is a gaming computer that Ryan and I built together. So again, he is my North Star. I love being in this space, and he is very much driving my mission-driven kinds of activities at this point.
Mm-hmm.
So I did the program, graduated in May of 2021, and said, okay, now I'm not only a dad, I've got the business skill sets. I'm now a quote unquote expert with a master's in public health from Johns Hopkins. Now what do I do? And what started to happen was very similar to what happened at Ryan House. These networks and these groups around the country started to kind of rally around me. And one day I said, okay, maybe I'm the guy, maybe now's the time. Let's really see if we can get a national effort kind of going. And so that's why we then incorporated what's called the National Center for Pediatric Palliative Care Homes and our program brand called Children's Respite Homes of America. Children's Respite Homes of America is a lot easier to remember, and it's our forward-facing kind of public branding program. And so we created that organization. We just celebrated our second birthday, so we're now in our third year of that organization. And what that does is it really brings together the national footprint that has been happening. So today, Children's Respite Homes of America now has over 37 pioneers and programs across 25 different states, all linked together, now formalized, trying to now bring awareness to this issue so that we can now collectively have a louder shared voice, so that when we now talk to federal policymakers, and so in our national organization, we now have a government affairs council with past Medicaid directors and healthcare advisors and experts. We've got a national advisory council. So we've elevated all of the leaders of these grassroots programs across the country into a national advisory council. That becomes our strategic brain trust, if you will. And now the goal is to go after federal policy. So that means introducing new laws into the U.S. Congress, and working with Centers of Medicare and Medicaid and the American Academy of Pediatrics and the other national hospice and palliative care type organizations to really bring attention to this particular children's population.
It's, it's just riveting that you could take this life experience that you and your family have obviously been so engaged in, and you've had to pioneer your own journey as well as different communities' journeys, right? And bring people along. And I'm sure there are days, Jonathan, when it seems like it's just been a slog. But when I look at you and I look at what's going on, I'm amazed at the transformation that you've been able to generate in a short period of time. Do you see that?
Oh,
You do?
I mean, I'm so passionate. One of my issues personally is that I ooze passion. I tend to be a flood of information. And oftentimes I have been so committed to this movement now that when I work with people and talk to people, I tend to be so much information. Yeah. And so, yes, exactly, Julia. There are days where I'm just so frustrated that I wish we were farther ahead, but I have to every once in a while pause and look back and go, wow, in just 2 years, we've brought together 37 communities across 25 states. We now have 7 existing programs that are operational across the country. What I'm excited about is that as word is getting out about Children's Respite Homes, .org, our website, through these webinars and opportunities to create awareness, pioneers are reaching out to us. Yeah. So I'm not necessarily reaching out to communities trying to find a leader to start a home. What's happening is the other way. I'm being receptive to those people that are now finding out about us, coming to us, and with very similar stories. They're either, hey, I'm working with a group in Iowa, for example, Mason's Lighthouse in Iowa. Holly and I just flew out to Iowa City last weekend to be speakers at their second annual gala. And Mason's Lighthouse is obviously, Mason is their child that died, and they're now memorializing that young child. Shanna, the mom, is a dental assistant, and the husband, Curtis, is in the construction field. And so these are not people that are business leaders, nonprofit leaders. These are people that are very committed, very passionate, and are rallying their own communities. That's the energy that I love, because I now Zoom with them all the time. We talk about what stage they're at, how to help them kind of move through the journey. And I've now done this through Ryan House, and I can reflect back. I was like, I didn't know how to do this when it started, but now when you reflect back, let's see if we can figure out those lessons learned, those best practices, and help coach you so that you can now move faster, so we can scale, strengthen, and sustain these houses much better, that we now have a national effort than what Holly and I went through 20 years ago starting Ryan House.
Right. Well, and it's just absolutely remarkable. I mean, when you think about Helen House being, in England, you couldn't just say, oh yeah, take a jaunt over there and you can tour it and learn. I mean,
right.
it was such a concept so far removed. And I've just got to believe that now with this number of properties and grassroots organizations, it's going to explode, because you have models for normal people to look at and say, we're going to get behind this, right? I mean, it seems to me like your trajectory.
It's exactly right. It's just
going to go up.
20 years ago, it was this idea of the overall concept is called pediatric palliative care. 20 years ago, very few people were even talking about that kind of care support for a medically fragile child and their family. Today, there are 285 children's hospitals across the United States. Most of those children's hospitals have dedicated pediatric palliative care teams, some of them much stronger than others. But the fact is, they all have them now, and their families are getting very good support when the child is in the hospital. So, as a family, I strongly believe that the number one thing that families on these journeys want more than anything in the world is a cure for their child. They will give anything to cure their child, as would I. I wish that I could go back in time and cure spinal muscular atrophy. It just, there are treatments now today, but they didn't come out in enough time to help Ryan live a longer life. But the second thing that these families need is, when they're living life in the community, they need support. And so that's really where our organization is focused, is really on the community support that these families really need. The hospitals and the science is amazing. There are now treatments coming out for these rare diseases. That's fantastic. But what also is a challenge with that is that children are living longer. That doesn't mean that they have a great life, and that doesn't mean that those lives are now easy. Those lives just are longer, and those families are that much more stressed. My son was not expected to live to 2, but he lived for 17 years.
Yeah.
So those kinds of journeys are very, very difficult. So our group is really focused on community-based care, and how do we help support those families? And I think that's what we're now trying to raise to policymakers and regulators, to really help redefine definitions of licensing and payment models at the federal level, and then work with the states to pull that down through, so that state licensing and regulations can happen here. The good news is, government people, we're now working a lot with government people at the federal level and at the state level. And I believe that government people are good people, that they want these kinds of programs to happen. The reason that it hasn't happened before is there's not been a group like ours to actually raise their awareness around it. So.
Right. It's the roadmap. I mean, and so many of the guests that we have that come on the nonprofit show, they talk about this. It's like, we need to be able to communicate, we need to inspire, and we need to be able to show what that process will be, so that we can get, dedicated buy-in and everything from thought leadership to philanthropic, financial. I mean, yeah. So I think that's just been fascinating. Well, it's such an honor, Jonathan Cotter, to have you on the nonprofit show. I've been such a big fan of yours. I know this is a hard week for you. I was at Ryan's service. It was amazing. It was a huge community event. And it was really powerful. And it was a lesson on perseverance and stepping up and leading. And you, my friend, have done that brilliantly. And now you've taken it beyond just our community. Jonathan Cotter, CEO and founder of Children's Respite Homes of America. Go to their site. It's really fascinating. childrensrespitehomes.org. You can see how they work, how they support, just all the things that Jonathan, you and Holly did not have.
Right. Exactly.
It's just remarkable that you have been able to do this. And so again, I say thank you on behalf of my community, but on behalf of our nation as well. It's really
well, Julia, thank you very much for the opportunity today and the nonprofit show. This is fantastic. It really helped, especially on a special day like today, Giving Tuesday. So thank you very much.
It's just been lovely. And I really look forward to having you back on so that we can kind of catch up and see what's going on and to learn even more lessons from you. You know, we have amazing partners that teach us lessons every day as well. And they include Bloomerang, American Nonprofit Academy, Staffing Boutique, Nonprofit Thought Leader, Fundraisers Friday, Your Part-Time Controller, Third Sector Company, and Clear Impact. These are the folks that join us day in and day out so we can really have these amazing conversations like we've had today with Jonathan Cotter. You know, Jonathan, every day we end the nonprofit show with this mantra. And today it means something different to me every day. But today it is like no other day. It has a very profound message to me. And the message is simple, but it's very complex. And it goes like this: to stay well so you can do well. Thank you, Jonathan.